Welcome, everyone. I see some folks joining us. We're going to get started in just a couple of minutes here. Thank you, everyone, for coming. People are joining at a rapid rate here. Just about 3 o'clock. I'm going to give people just a couple more minutes because I see folks still joining. Letting folks get in here. We'll go ahead and get started. All right. Well, I'm going to go ahead and get started. My name is Melissa Cruz. Welcome to today's HLA webinar, Advocacy at a State Level with Cynthia Stewart, who's the HLA Legislative Liaison from HLA Washington. And thank you for joining us today. We're going to start off by giving you some tech tips to see captions on this webinar. You'll need to click on the CC icon and click on Show Subtitles. You can increase the caption font size by, again, clicking on the CC icon and clicking on Subtitle Settings. You can change the font size there. The chat feature is going to be available for technical issues and for the panelists only today. We'd like participants to use the Q&A icon to ask questions. We'll also be using this to facilitate Q&A after the presentation. And if you've joined by computer, your screen should be in a side-by-side mode, and you can change the size of your side-by-side view by hovering your pointer over the shared screen and adjusting on the sliding to adjust to your desired view. If you've joined by iPad or on your cell phone, it may be a slightly different view and you may have to scroll to get to the view that you want. And just a quick disclaimer that HLA is not endorsing any specific products featured in this webinar. We're just providing an educational opportunity to learn about new things and new opportunities and how they could benefit people with hearing loss. Our webinars are recorded and will be available on the website after the webinar. And now, as I mentioned, our presenter today is Cynthia Stewart, and I'm now going to turn the presentation over to her. Welcome, Cynthia.
Thank you. It's so nice to be here. Thank you for the opportunity to discuss this really important issue. And also thank you to the audience for your interest in this. I'm going to talk about myself for just a minute before I get started with this PowerPoint. And that is to say that I've had a very severe hearing loss since I was 3 and had the measles. And thank goodness we now have a measles vaccine, so children don't have to experience that. We still have people who, young people who have hearing loss, and I'll talk about one of those cases shortly. So the other part about me is that I worked in government for most of my life and most of my career, I should say. And somebody suggested about 25 years ago that I should go into lobbying. And I said, oh, I can't do that. There's no way I can do that. But what I want to say now is that after I retired and joined the League of Women Voters, I found out I could do it. So if I can do it, anybody can do it. And I encourage you to listen to some of this with that understanding and that confidence. So I'm going to share my screen now and get started in the prepared comments. Let's see here. I've got to do slideshow. And here we go. So what I'm going to talk about is this list of things. So why is state advocacy important? And what does it require? What is the process that you go through? What are some key strategies? And what are some pitfalls? And then I'm going to walk you through some examples from Washington State to show you how those things that I'm talking about play out in real life. So the reason that advocacy at the state level is so important is really we want equity. We need equity. We need things to be addressed, things to be provided for us that other people may not need. And that is what puts us on a level playing field with other people. We know that hearing loss is ubiquitous. It happens all over the country. It happens all over any given state and at all age levels, but particularly among seniors. We also know that it's invisible and not well understood. So one of the things that advocacy provides is an opportunity to do a lot of education. But also because it's invisible and not well understood, the needs of people like us with hearing loss are really not addressed often. And so that's one of the reasons that we need to go and ask for policies and strategies that cross over local boundaries in order to be effective and create more equity for us. So the things that are required to do successful advocacy, one of them, a really key one, is really understanding the legislature. And I work with the League of Women Voters as a volunteer, as well as HLAA. And one of the things that we have found is how many people do not understand civics in general. They do not understand how government works, how the policies are set, the difference between the governor and the legislature, or the process. So that is almost step number one, is really understanding how your legislature operates. And most states are similar, but some are very different. And so I'm going to be using Washington State as an example, but it's mostly to say, these are the kinds of elements that you want to look for in understanding your own legislature. And then it also requires being very patient with people who have no idea what hearing loss is about. And that will be almost everybody you deal with, whether it's legislators themselves, whether it's staff, whether it's other people in organizations you might approach for allyship and for partnering. And then another thing that is really necessary is finding a hero. So if you're going to be promulgating state legislation, it's very important to have a hero, particularly a legislative hero, but it also could be a community hero. And I'll tell you a little bit more about why that might work. But you also need a village. You need a lot of people weighing in and providing community support for what you're trying to do. So those are really key things that will help you get your legislation through if you decide to proceed. So the first step is planning ahead. You want to define what your goals are. You need to identify who needs to hear your message. You need to identify who your allies are and who your opposition is, and define your timeline. And timeline can be really critical. And then using that information, you approach the decision makers appropriately. So in terms of goals, do you want to change a law or do you want to get a new law passed? And in our case in Washington, we have done both. In the examples that I'm using, we'll talk about new legislation, but there are times where there are statutes that are out of date or haven't included people with hearing loss that may need to be adjusted in that way. So you might be wanting to change something, or you might want a brand new piece of legislation. Do you want funding? Do you want a program to be funded? Do you want a facility or some equipment to be funded? Those are things that you would need to know before you start talking to your legislators. And then sometimes there's a law that has already been passed and that goes through what we call the rulemaking process. And that's where executive branch departments set up. In our case, it's called the Washington Administrative Code, but it's the implementation regulations. Sometimes that is the place that you want to go. And so defining whether it's something new, whether it's a change in a law, whether it's an administrative rule that needs to be changed or added, those are things that are necessary to figure out before you get started. Now, who needs to hear this? So there are stakeholders, obviously. There are people who are affiliated with people who have hearing loss. There are people who have actually the opposite form of stake in it. They might be opponents in the end. But who needs to hear your message are the people that you can draw support from. And then who are the decision makers? Is it actually the state legislature, or is it actually a city council or a county council? Or is it actually an administrative or a regulatory agency? So sorting all that out as part of defining your goals is just critical. And then how can the public be involved? How do you educate them? How can you get them to weigh in? And in order to do that, they probably need to have some messaging provided to them. So they'll talk about identifying your allies, but also your opposition. The allies are the village. The allies are the people that will step up and help you get your legislation passed. And some examples include HLAA members. And if you have a statewide chapter, what you will do is you will ask your members to talk to their legislators and distribute the message across the state, not just keep it all in one place. You will want to have support from other groups with the same interest. In our case, AARP has been invaluable, and that's logical because of the fact that as we age, we have more people who tend to have hearing loss. But there are also audiologists, people in the profession who can be supportive. There are organizations for the deaf and hard of hearing. There are organizations that support children with hearing loss. And then there are community centers and other kinds of organizations that have an interest because of their customers or their users. And they could also be allies for you, creating that village that helps to get your legislation passed. Now, what we have found is that there are opponents as well. And in our case, we have run into problems with the medical associations, with insurance companies, and actually even with business owners who are in retail business. And we've had trouble with the hospitality industry opposing some of our proposals. So actually thinking about what the implications of your goal are, and then how to really figure out who might be in opposition to that. In our case, we've been surprised a few times, but we learned to try and do a better job of figuring that out. Now, your timeline is critical also. One of the messages that I want to make very, very clear is that most legislation does not pass in the first go-around. And I'm talking about all kinds of bills, all kinds of issues. We have had an example where we got something passed in the first year, but not most of them. And so understanding your legislative process is important to figuring out what your timing is. When do you talk to your legislators? When do you bring your community forward, and so forth? So I'm going to give the Washington State Legislature as an example, recognizing, of course, that yours may be different. So the Washington State Legislature operates on a biennium, and a lot of this can be found, a lot of the information I'm going to talk about next can be found on our Washington State Legislative website, which is leg for legislature, .wa for Washington.gov. And what I know from a lot of conversations with many people is that it is considered the best or one of the best in the country. Not every legislature has a website that is as thorough and informed as ours. So the stuff that I'm going to be talking about now, you would hopefully be able to find on your own legislative website, or from talking to staff or other people. Hopefully you can hopefully you can find it on your legislative website. So the biennium means that it's a 2-year session in Washington State. In the even-numbered years, all of the representatives and half of the Senate is up for election or re-election. What that means is that the even-numbered years, the sessions are shorter, so they can be done with it and be out campaigning. The odd-numbered years are the beginning of the 2-year biennium. And in Washington, that means that in the odd-numbered years, we have a much longer session, 105 days compared to only 60 in the shorter second year. Most bills are introduced in the first year and fewer in the second year. Any bill that's introduced in the first year continues through the second year. And then at the end of the 2-year period, if it hasn't passed and somebody wants to try again, it gets reintroduced with a new number as a new bill, a brand new bill. So they start in the first year, they go through the second year, and then they're dead if they haven't passed, and they have to start over. So in the first year also it's the heavy lift year. It's when the budget is passed for the following biennium. And then in the second year, what happens is they make adjustments to the budget based on the anticipated revenue and based on new information. But the first year is the year that if you have a cost item, you want to get it included in that budget, because it's much harder to get it in the second year, especially if the revenue changes are going down and not up. So I think I've covered that biennium. Here's an actual calendar kind of a chart. So in January 23, the first year, the biennium started in the first year. It ended in April, and then the legislature was in recess in May through November. In December, they come together and they have what they call committee week or committee weekend, where they kind of get ready for the next session. And then, of course, there are holidays. So the recess part is really May through November. In January 24, it was the beginning, this past year, the beginning of the second year, ended in March. Campaigns began like right away. And then the legislature is in recess from the end of March through December. And so after elections, this legislature is going to start up on planning for the 2025 session in December. So as I mentioned, bills can take as much as 2 years to pass. And here are some examples. I don't know if you can actually read this, but I hope you can. What I want to show is not the details on the bill right now, but actually this one was introduced in 2018, which was the second year of the biennium. And that's actually a good year to get legislators acquainted with a new issue, but never necessarily expecting anything to pass. So in the second year of that biennium, a new bill was introduced, and it passed in 2019. It was the same basic idea. And again, it took 2 years. The next one started again in the even year, and then ended up passing in the odd numbered year, the first heavy, what I call the heavy lift year of the biennium. Then we had one that started in 2019, which would have been the beginning of the heavy lift year, but it took several years to go through all the iterations and concerns that people had, and that didn't pass until 2023. So you can see that planning ahead, trying to figure out your timeline, and knowing full well that you're not necessarily going to get what you want right away kind of helps figure out how to approach it. Now, another confusing part about the legislature is what is the process that bills go through? So it starts with being proposed legislation. A legislator introduces the bill. It goes to a policy committee, and then sometimes it goes to a fiscal committee. And in each case, it has to have a hearing, and it has to get voted out of the committee with a do pass recommendation. And then it goes to what we call the floor. Excuse me. The floor is where all of the legislators in that chamber vote. So all of the House of Representatives or all of the Senate. Then it goes, if it passes, it goes to the opposite chamber. It starts all over again, goes through the policy committee, goes through the fiscal committee, hopefully passes on floor action. And if it passes both chambers, it goes to the governor. Now, what also happens is there's a negotiation process. So let's say the House adopts one form of the bill and it gets amended in the other chamber. Then what has to happen is they have to negotiate it, and then both chambers have to pass the exact same bill in a separate action for it to get to the governor for signature. It's very rare, actually, that a bill starts on one side and ends up on the other side in the exact same form. So when you're working with your legislature, if there's a process like this, tracking it all the way through it can be challenging. And what is important to know about this is not only about the fact that there are amendments to the bill, but also that for every single committee hearing there is, it's important to have somebody testifying. And then making sure that as many people testify as possible. In Washington State, we get to testify remotely, which is wonderful. It didn't used to be that way until the pandemic, but they kept that opportunity, which has been really, really terrific, because that's the way people all around the state can be heard, not just the ones that live in the capital city. So I wanted to use the same diagram to just show where there's some barriers that you might encounter. So not every bill goes through a fiscal committee. And the reason for that is they don't all have a fiscal impact. And the fiscal committee is where they say, yes, we support this bill because we think we can afford it. So funding can be a huge barrier to certain legislation if you're asking for funding for equipment or facilities. Or services, I should add. Now, in addition to that, we've had some experience that I'll talk about in a minute where the committee chairs can be the barriers. The committee chairs are the ones who decide what's going to go on the agenda. And if they never get you on the agenda and you never get a public hearing in the committee, then the committee can never take a vote and your bill dies. So just things to watch out for in this process. So how to get started? Once you've got your goal and you've got your timeline, the first thing to do is start to talk to legislators. You can do that at the beginning of the session, but they're usually really bogged down almost immediately with stuff they have in mind. So you want to get your issue in mind before the session starts. And the best time to do that is when the legislature is in recess. So this is an earlier diagram, but just uses the same 2-year format just to show you that the best time to meet with legislators is, in fact, when they're in recess. And you start by figuring out who the leadership in HLAA who wants to do this starts by figuring out who their own legislators are first and start there. Now, that may not work, but it's a good place to start. And then they can potentially get on board, or they can potentially also tell you who else you should talk to. So identifying a lead is really important. For one thing, it's important for anybody working on legislative issues to speak with one voice. So you want a lead who can both understand the process and track the process for you, interpret what is happening, call on the right resources at the right time, and then last but not least is that part about coordinating messaging. So you not only want to have speaking with one voice, in other words, you're all saying the same basic message, but you want to have some sense of when you're overdoing it or when you're underdoing it. So having somebody in charge is really, really important. I know that typically goes without saying in any particular project, but in this case, it's ultra important. I talked to you earlier about my own background, and the reason I'm bringing it up now is that you don't have to have a lead who is a lobbying expert. You just have to have a lead who is somebody who understands communication and who is willing to go through the process of figuring this stuff out. And I will add at this point that I'm more than willing to meet with any of you if you contact me later. I cannot do a very thorough job of helping you in your process, but I can certainly help you get jump started. So when you're talking with legislators, there are different ways to do it. You can meet with them. You can talk to them on the phone. You can email or send letters. In Washington State, legislators vastly prefer email. Managing paper for public disclosure laws is really getting problematic. And so many people use email anyway. It's so easy for them to file it and keep track of it. Much, much easier than paper letters. Some people, though, need to write a letter, and so it's okay, but it's not the preferred method. The best way to communicate with your legislator is to contact them and set up an appointment. So meetings in person, during the session, you will never get more than 15 minutes, at least in Washington. So when you get started, you want to think about if you can get together with your legislators during that recess time, you not only have a more comfortable conversation, but you have a longer one, and you have more opportunity to really get your point across. During the session, it's just really challenging. Secondly, if you've met with your legislator, they will remember you when you come back, either in email or testimony or whatever it is. So that's why the in-person meetings are very preferable. Now, when you have met with your legislator, hopefully, or even if you can't, you need a relationship with the legislative aide to that legislator. And the reason why is that person is a doorkeeper and also a communicator. So the legislative aides help set up appointments. They also can be a barrier if they don't like you. And so I always say the legislative aides are my very best friends because they can communicate for me in between. They can tell me what their legislator's thinking. They can take messages from me to the legislators. They're the ones who typically screen the emails. So you really want them on your side. And establishing that relationship, you can just do that with the phone if you want to, or by email. But making sure that you are constantly complimenting and thanking that person is really, really helpful. So I think the only other part about this is during the actual session, if you send a letter to a committee in lieu of oral testimony, and sometimes you need to, that also can be by email, by the way. Those communications are filed and put in the record. So if you're going to do that and you want them to pay attention later and not just at the moment, you send those copies to the committee chair and the staff in advance so they know that what you're going to say and they know that there's a record to be kept. I know this sounds really complicated, and I think it's not as complicated as it sounds, because once you kind of understand the process, it makes a lot of sense. Now, another thing that's going to be critical for success in the state legislature is making sure that your members and other advocates who are supporting you actually know how to approach their legislators effectively. And this is a little guide, and I'll show it on a bigger screen in a second. It's a little guide that I got years and years ago from another organization that has turned out to be extremely valuable. If you think about your hand, and then you think about fingers 1, 2, 3, 4, 5, it's really easy to remember this. So the first finger is introduce yourself. And by the way, you can read the fine print if you go ahead and download the PowerPoint later. But introduce yourself. Who are you? Why are you talking to them? And then your second finger is, what is your subject? What is your issue of concern? The third one is a little different than that, but similar. Why do you care so much about this issue? And that's the place to talk about the equity concerns that people with hearing loss need a little extra support to do a lot of things and to be equal, to have an equal playing field with others who can hear. So why do you care? The fourth finger is why should the legislator care? And that really has to do with we are your constituents. You have a population that you may not even realize it exists in your district. This is a population that is organized. You should really care about the needs of this population. And then the final thing, not the first thing, you've stated your issue, but now you say, here's what we need. And that's where you really make what we call the ask. This is the final point about how can you help us? You can do the following. So another thing that is really, really helpful is the education process, not just for the legislators, but also for other people who might be allies with you, who may not really understand hearing loss very well, but want to be supportive. So in Washington State, Sherry Perizzoli actually did a lot of work with some communications experts and developed materials, but HLAA National has a lot of material as well. And so you can either use that kind of boilerplate material, or you can have some other people redesign it and reconfigure it to be more specific to what you have in mind. In this case, it was, here's some information about hearing loss. This was for a telecoil bill. What is a telecoil? What is Bluetooth? How are they different? Why we need legislation, and so forth. So it was a two-piece thing. When you meet with legislators and you have a piece like this, talk about it, but don't hand it to them until the end of the meeting. The reason that's important is if you hand it to them when you start, they're going to be looking at it, not listening to you. And I've found over and over again that giving them something at the beginning is a big mistake. But having it, the other thing it does is when they put it away in their office, they will remember you later, because they will have it on file. They will attach it to a certain legislative file, and it's really important for them to remember you. So another point that I made was to recruit a legislative hero. And this is that same table I showed you earlier about these different bills, and I'll go into detail about them a bit later. So that isn't my focus in this slide. My focus here is that we had one hero, Senator Bailey, who really worked hard with us for several years. Then we had another hero, Representative Dolan, who worked with us for a couple of years. We had another one named Senator Patton, and then we had Representative Wicks, and then Representative Orwell followed her in the same path. And so these are, and they did that because Orwell was a friend of Wicks, and Wicks left the legislature, but we had continuity. So developing somebody who's your hero, who can be the spokesperson, who can be the sponsor of the bill, who can really advocate for the bill during the session with their other peers, that's super, super helpful. The other kind of heroes that you have are people like Sherry, who is kind of ubiquitous, and she kind of does all the background work and really draws people in and is extremely supportive. Another example, though, is Jill, who is out in the community and not a member of HLAA, and we've hooked up with her because her bill was about children and the need for coverage for hearing aids for children. And having more than one child is even more important because it's very, very expensive, as you all know. So drawing in people that I call heroes are kind of central figures from the community who who have stories to tell or who can be really helpful behind the scenes. Really, really critical to getting somewhere with your legislature. I'm going to just check my notes here. I think I was going to say more about Jill, but I'm not sure if it was on this slide or not. So yeah, I think I will now. So I want to go back. I'm sorry I made this move too early. I want to go back and talk about Jill and Hugo, her son. This is representative of the power of a personal story, and with legislators, they love personal stories. And so Jill had her son and lined up other parents with children with hearing loss and had them testify every single time the bill came up in a committee meeting. She also, and she is not a lobbyist. She is a physician's assistant, and she had no idea how to do this, but she figured it out. So my other reason for sharing this is to let you know that you don't have to be a professional. You can figure this out. So one of the most amazing things that I've ever seen from watching this session for about 20 years now is that our bill, which is her bill, went through the policy committee, and then it got to the fiscal committee. It got passed out of one chamber and went to the other side, went through the policy committee, and then it hit the appropriations committee in the other chamber. And what happened then was very unique. When Hugo told his story, we had legislators actually in tears. And I've never seen that happen before. It was so powerful that the chair of the committee adjourned the committee and put the committee in recess, went down and took pictures with Hugo, went back into committee and passed the bill out of committee with a unanimous vote. Now, for them to do, usually what they do is they have the committee hearing where they get testimony on one day, and then they have what they call executive session where they talk about it and they mess with it sometimes, make amendments, that kind of thing, and then vote up or down. They just stopped it and they did it at the same time. I've never seen that happen, and I've talked to a lot of lobbyists who've been around longer than I have, and they had never seen it happen either. So that illustrates the power of a personal story, and it was even more compelling because Hugo is very bright. He is a small child, but he gave this powerful message about the need for hearing aids and what happens when you're a child and you don't have hearing aids. Now, when I grew up, I did not have hearing aids with my severe hearing loss until I was about 25. And I can vouch for the fact that going to school without them was horrible. It was very challenging. but my story would not have been as impactful as him right now, today, giving the same example and the same story. So anyway, that is an example of how you use your advocate heroes, and it was really, really compelling. So I'm going to talk about other tips, and then I'm going to move on to some other more specific examples. So I mentioned getting acquainted with the staff. There's also policy staff for most committees that are really important as well. They're the subject matter experts, and they're the ones who typically work with the legislation and the writing of it, and the talking to legislators about the meaning of it. So getting acquainted with them can be super helpful also. Another tip is, and this seems like common sense, but you would be amazed how many people don't do it. After every single step, send a thank you note. Now, I have gotten thank you notes from legislators saying, thank you for your thank you note, because nobody ever does that. And I'm so grateful that you acknowledged it. So that just tells you the power of a little tiny thank you note. It can be 1 or 2 sentences, but just the acknowledgement of their action and their support is just critical. Another tip, and I know this is hard to realize, but don't be intimidated by the people or the process or the timeline. If you just get a stable, calm approach to it, you can do it. And it takes a lot of thought, it takes a lot of research, but you can do it if you just say, I know other people that have done this, I can do it too. When you get opposition, do not argue. Never, never argue. You thank them for their input. You may want to say, how can we fix this? But just never say, but you're wrong. That does not go over well. And then finally, not quite finally, but asking for advice after you've had something happen, whether you've gone through a session and it's been successful, or particularly if it's unsuccessful the first time, you want to go back and say, can you tell me how we could have done this differently? Get some debriefing going on. Get it from staff, get it from any legislator that's willing to talk to you, or get it from other ones of your allies who may have seen something you didn't see. So getting that advice will help you in the subsequent years. And then finally, have a lot of fun, because learning something new and how to do this it can actually be fun. It's good for your brain, and I certainly have enjoyed it. Every day is a new day, and I always learn something. So I'm encouraging you to think about it that way. So now I'm going to show you some examples of how this plays out. So the first bill that I want to talk about was a lack of understanding about what telecoil is. And Bluetooth was being promoted heavily by hearing aid manufacturers. And so what we wanted was to get a bill that said that people had to be told about telecoil as well as Bluetooth, so that people were not missing that telecoil opportunity. So our legislative hero was Representative Lori Dolan. She has hearing loss, and she also, when earlier in her career, taught children with hearing loss. So she completely understood the issue. And so she jumped on board, and she was extremely helpful in working this bill. Excuse me. We didn't get it out the first year, but she just kept persisting. So in 2017, we had House Bill 2856. The title of the bill was Concerning Notification to Purchasers of Hearing Devices about Audio Switch and Bluetooth Technology. Now, this bill didn't go anywhere in spite of Lori lining up supporters. And the reason why was the Healthcare Committee chair didn't ever allow it to be on the agenda for a public hearing. We don't really know why, but she did this a couple of times in different bills that we wanted. And so fortunately, there's a different chair now who's a lot more lenient, but this particular chair was kind of hard to work with. So what happened then was in the next biennium, Lori was able to get Senator Barbara Bailey on board. And so in 2019, it was almost the same, but not quite the same, Senate Bill 5210 and House Bill 1078. So as I mentioned, when you get to the end of the 2 years, if you want to proceed, you have to introduce a new bill with a new number, which is what this was. Notifying purchasers of hearing instrument about uses and benefits of telecoil and Bluetooth technology. So Senator Bailey, who was the Senate sponsor, also has hearing loss. And so she had more influence actually. And so she got it passed in the Senate. And then the committee chair allowed a hearing in the House committee. And the bill was passed and signed that year. So another example, the need that was identified was that when you go in a public place, people with hearing loss couldn't understand or use the television. So whether that was a retail store demonstrating, whether it was going to a hotel or a motel or a bar or a restaurant where televisions were being played, people with hearing loss couldn't have the benefit of understanding what was going on. So there was a bill that our hero introduced, Senate Bill 6182, concerning closed captioning on televisions in places of public accommodation. And what it did was it said that if there is a television being shown for the public advantage, it has to have captions also on it. And Senator Patton also had hearing loss, and he got it through the Senate, but it did not pass in the House. It made quite a ways through the process, but it just didn't pass. And so in 2021, and mind you, again, this is another example of the even numbered year is the short session. When a bill gets introduced, then it's often more of an educational process than it actually is an expectation it'll pass. So in the next year, it was reintroduced. It did have the same title, but it had a new bill number, Senate Bill 5027. And that year, it passed the Senate and the House and was signed by the governor that same year. So the difference between the short year of the biennium and the long one is significant. And then there's another example, which is, and this is the one where Jill was working on it, maybe even before we were working with her on it. But the issue that was identified was that there is no coverage for children needing hearing aids. Now, Jill and her family were actually able to afford hearing aids for their children, but not everybody is, as we well know. So she identified Representative Christine Kilduff, who sponsored the first bill in 2019, House Bill 1811, concerning coverage for hearing instruments for children. Now, this is another case where the House Healthcare Committee Chair never allowed any public hearing, and that went on for 2 years. She never would allow it to be brought up for consideration. So then 2 years later, in 2021, a new bill was introduced, House Bill 1047, requiring coverage for hearing instruments for children and adolescents. So it was modified a little bit after negotiation with certain parties. The hero in that case was Representative Emily Wicks. Emily Wicks has hearing loss. And so again, the challenge in 2021 was that the same House Healthcare Committee Chair never allowed it to come up for a vote. So continuing on with that bill, in 2022, House Bill 1854 was introduced. It took the beginning of the children's issue and it expanded it to other populations. And this was with the support of the Office of Insurance Commissioner and some policy experts in the state of Washington. So House Bill 1854 was introduced. Again, our hero was Emily Wicks, and it requires coverage for hearing instruments for a broader population. So again, the House Healthcare Committee Chair refused to let it come up for a public hearing until she got really a lot of pressure, and then she allowed it on the very last day. But as I mentioned earlier, they typically have a public hearing, and then they wait a while, and then they have the executive session where they vote. Well, on the very last day before the cutoff for policy committees, there was no way to get it to a vote. So it effectively was the same as not getting a hearing. So here we go back to the first year of the next biennium, 2023. And this was a similar bill. It was given a new number, House Bill 1222. And it had a new hero because Tina Orwell was working with Emily Wicks earlier, and Emily Wicks had resigned from the House. So Tina Orwell picked it up, negotiated with policy staff, the Office of Insurance Commissioner, the Health Care Authority, and other legislators, and really worked hard and got that through. It passed the House, the Senate, and the governor signed it in 2023. So I think this example portrays the progression that you have to go through, and it portrays the value of persistence. I think it portrays the need to be flexible and broaden the scope if necessary, and so forth. So this is also the bill in 2023 where, and I'm almost done, where Hugo made a huge difference in the House of Representatives because he got the fiscal committee to pass on it, which they might not have otherwise. So anyway, in summary, you need to do legislative action sometimes so that the people with hearing loss can have equity in life. It is possible to get bills passed, but it may take time. We need a legislative hero. We need supporters. Training can be very beneficial in that. You can figure out who your opponents are. And actually the one bill that dealt with hearing television captions in public places drew out opposition from retail salespeople, from the hospitality industry, motels, and that kind of thing. And then finally, educating your legislators is just part of the process and very important. And finally, just to know you can do this. Thank you. I'm ready to take any questions you may have.
Wonderful. Thank you so much. Cynthia, I think one of the first questions that several people asked was, are you okay with us sharing your presentation with attendees, your PowerPoint?
Oh, absolutely. Yeah,
Wonderful.
absolutely.
Okay, then I will. Everyone who
I
has
assume that's an expectation.
Okay, some folks aren't, so I just wanted to make sure, but I will, as long as you're comfortable with that, then I will be emailing out a PDF copy to all the attendees. And now let's go to the Q&A. Someone asked, why might medical associations or insurance companies be considered opponents?
Well, in the bill, well, in one case we had the person representing audiologists opposed to the telecoil bill that we're promulgating. In the case of coverage, insurance companies were ultimately required to provide coverage they hadn't been covering earlier. And what they do is they spread the cost of a new service across all of the population, but they were objecting to that because the cost of hearing aids is very high. And so there was a lot of opposition in that regard.
Okay. Someone said, congratulations on your successful efforts in Washington, but they're concerned that these things have to be done at a state level. Could any of this be undertaken or proposed as legislation for a nationwide law? what are your thoughts on trying to do some of this on a national level? I can speak to that a little bit from HLA's perspective of we are addressing things on a national level, and we do advocate, we do meet, Neil Snyder from our office is always out working on issues that impact folks with hearing loss on a national level in DC. But Cynthia, can you maybe address why some of these things might be better on a state level than on a national level?
Well, I think it's less complicated at the state level than the national level. And I honestly don't know what capacity HLAA has. So I can't really answer that. I think a lot of this would be better at the national level, but getting it to happen may be a little more challenging.
Okay. And then someone asked, are many state legislative processes similar to Washington's? Where would someone go to better understand their own state's legislative process?
So I think if you Google your state and legislative process, you would get some information. If you're lucky and you have a state legislature that has a website like ours does, that has amazing information on it. I don't have time to share it. I wish I did. But you can also Google your state legislature and see if it comes up with a URL that goes to a site that has background information. Another way to do it is look for civics education in your state. So in Washington, we also have a pretty strong, the League of Women Voters actually has a very strong civics program that we promulgate in the schools. And so civics education is another place to look for that information. If you want to do it and you can't find it easily, let me know and I'll help with the research.
Wonderful. Someone else asked, how easily can you find out whether or not your state legislator has voted on prior hearing loss or disability-related legislation in hopes of finding out if they'd support a particular bill? And how is there any way to find out if they have hearing loss or any relatives do without violating privacy laws?
The way that we found out was just by talking to people, and people know people. And so in the case of Senator Patton, for example, somebody told me or told others that he had a hearing loss, and so we approached him. And sometimes legislators will approach another legislator because they don't want to be the prime sponsor, but they can get somebody else to do it that they know about. So it's word of mouth. It's having a conversation and having them tell you, oh, you're from the Hearing Loss Association. Well, I actually have a hearing loss too. So it depends on who the person is and what kind of network you have and whether you have personal contact or not.
Someone else asked, how can partnering with like-minded organizations help or hinder the process? If helpful, what is the best way to engage with and bring these organizations on board?
Very seldom would you have an alignment with another organization that would hinder the process. But the way they can help is because they're doing their own work and they can say, and also, we also support this bill from the Hearing Loss Association. So I work a lot with AARP, for example, and I mentioned that at the beginning. They're extremely helpful because they have many of the same interests that we do. The audiologists can be great allies when they're not annoyed with you for asking for more than they want to give. So it's just, again, finding similar organizations that have a similar interest. It almost never hurts.
Great. Someone else asked, what happens if there's no enforcement? For example, many public venues do not turn on captions, and when asked to do so, they refuse to do it.
That's a case-by-case scenario. I think that being aware of being able to say it's a state law would be helpful. Enforcement is challenging in that particular example, but if it happens over and over again, you can go to I can't cite it right now, but there's typically some part of your state agency that has to do with ombuds or complaints. So it might be in your social services department, it might be the attorney general. We have a very strong attorney general ombuds program in Washington also, and they can help. So finding that ombuds type person is usually the best way to deal with that, and they will follow through if you can't.
And
I
I think
think
this is,
I think the big thing here is that most people don't know about the law, so they initially resist. In a case like that, we have a lot of people from the hospitality industry complaining about our proposed legislation, and they didn't win. And so I think that, however, they did not promulgate this information among their clients. And so when you tell somebody, well, it's actually a state law, they may not have known that. So they may change and not be opposed.
and I think this is going to be our last question because we are right almost at 4 o'clock. How do you find lobbyists who can give their services pro bono? And also, did you find that Heroes allowed you to talk directly to the person writing the bill? Because if it wasn't written correctly, it could have a significant impact.
So I don't know how to answer this from other states, but in Washington state, and I think I'm going to answer the second part first. In Washington state, you develop a concept with a legislator who's willing to support it. And we typically go in with a fairly developed concept, but we are not bill writers, and the legislators don't write the bills either. There's a section in the legislature called the bill drafting section, and they're the staff that put it into the right format and the right language and all the right stuff. So all you have to do with your legislator per se is talk about what you want them to do for you. They will help take it forward. I think I missed the first part.
How you might find a lobbyist who would give their services pro bono.
I don't know. I would start with your League of Women Voters and see if they have an advocacy section. That's where I got my experience, and I'm still working as a volunteer there, as well as for HLAA. But you could just kind of, if you have a public disclosure commission or some kind of an agency like that, look through the lobbyists who've registered and see if you can find the ones that have clients that are very similar to your interests, and then contact them and ask them if they would help, because you don't have any money, but you have a similar interest.
All right. Well, I think we are now past 4 o'clock. So I want to thank you so much for presenting. This was incredibly helpful. As I mentioned, I will be sending out Cynthia's PowerPoint to all of the people who attended today. We will be putting this up on our website. If you haven't checked out our new website, please do so. And we look forward to seeing everyone next month for another webinar. Thank you so much, Cynthia.
Thank you all. I really appreciate your interest, and I hope this was helpful. Thank you.
Thanks.